Welcome to EMTprep.com. This is the Patient Assessment Management Medical Skill.
Welcome to the Medical Patient Assessment and Management Practical Assessment. Here we will evaluate your ability to assess a patient, interview them, and verbalize the treatment of all conditions you find. As you move through the skill evaluation, I want you to voice everything you are assessing. During the assessment, you will have 2 EMT partners to assist you. I may have to clarify treatments with you during the assessment as they arise. You have 15 minutes to complete this skill. You may take this time to review the equipment before you. You arrive on scene to a 24-year-old female who's complaining of difficulty breathing. Your scene is safe, and you may begin the assessment at the patient's side.
Okay. BSI, is my scene safe?
Your scene is safe.
All right, so based on my dispatch information, my patient's nature of illness is respiratory distress or difficulty breathing. Is this my only patient?
This is your only patient.
Okay. Right off the bat, I'm going to request an ALS ambulance.
ALS ambulance is en route.
All right. Based on the nature of illness and my patient's presentation, I don't think C-spine is something that I need to consider. So general impression is I have a 24-year-old female seated in the tripod position, having difficulty breathing. As I walked in the door, she's alert and conscious, so I'm going to give her an A for level of consciousness. So, ma'am, my name's Dan. I'm with the ambulance. What seems to be the problem today?
My chest just feels really tight.
Okay, and it seems like you're having some difficulty breathing, is that right?
Yeah.
Okay. So her chief complaint is, again, difficulty breathing. So the first thing I'm going to do is move through my ABCs. A, airway. As I listen to her, can I hear air moving through just fine? Do I hear stridor or anything like that?
She is having difficulty breathing.
Okay.
But she is moving good air.
Okay, so she's moving air well enough. So breathing, I would assess a respiratory rate either with a stethoscope or by standing or watching and counting. What is her respiratory rate?
She's breathing at 24 times per minute.
Okay. So along with the breathing, I also want to listen to lung sounds. So can you take a couple of deep breaths for me? All right. Last deep breath. Okay, what are my lung sounds?
You have wheezes in all fields.
All right, based on that, I'm going to go ahead and put my patient on high flow oxygen right now. I'm going to use a non-rebreather and go at 15 liters per minute.
You can verbalize putting the oxygen on the patient.
Okay. So after breathing, we're going to move on to circulation. First, I'll check a pulse. What is my pulse rate?
Pulse is present, and it's at 96 beats per minute.
Okay. Do I note any major bleeding?
No major bleeding.
Okay, and then moving on to skin. Skin color looks pale. Do I note any cyanosis anywhere?
No cyanosis.
Okay, and as I feel it, does she feel warm? Does she feel cold?
Normal temperature.
Okay, and do I notice, is her skin wet? Is she sweating, anything like that?
No, normal.
Okay. So I'm going to go ahead and make this a priority patient. We'll try and transport her as quickly as possible. So next I'll move on to my my OPQRST. So ma'am, how long ago did this start?
About an hour ago.
Okay. And what were you doing when this started? What provoked this?
I was just watching TV.
Okay, just watching TV. And can you describe the feeling for me?
Yeah, it just feels really tight in my chest.
Okay. And on a scale of 1 to 10, 0 being not difficult to breathe, 10 being I can't breathe at all, where would you rate this?
I'd say about an 8.
About an 8, okay. And again, how long has this been going on for?
For an hour.
Okay. So, and then after I've got my OPQRST done, I'll move on to my sample and try and get a little bit more information. So, do you have any allergies?
Yeah, I'm allergic to penicillin.
So you're allergic to penicillin. Are you on any medications currently?
Albuterol.
You take the albuterol, okay. And past medical history?
I have asthma.
Okay, you have, oh, so that's probably what the albuterol is for. What was the last thing that you took as far as food, last oral intake?
I had breakfast this morning.
Okay. All right, and events leading up to this, what were you doing again that caused this?
I was just watching TV.
Just sitting there watching TV. All right. So next I would move on to my secondary assessment. For this patient, I really want to listen to lung sounds again and reassess that. So I'll listen again. Have my lung sounds changed at all with the oxygen?
No, they're still wheezy.
Okay. Has my patient's ability to breathe, does she feel a little bit better with the oxygen?
She is breathing easier with the oxygen.
So after my secondary assessment, I would obtain a baseline set of vitals. So first I would acquire a pulse rate.
Her pulse is 90 beats per minute.
90 beats per minute. Okay, and what's her respiratory rate now?
Her respiratory rate is 20 breaths per minute.
20 breaths per minute, okay. And lastly, I would get a blood pressure. All right, and what is her blood pressure?
Her blood pressure is 112 over 70.
Okay. All right, so now that I've got my baseline vitals, my field impression of the patient is that she's having an asthma attack. At this point, I would do interventions. If she had her albuterol inhaler with her, I could assist her with that. And then after that, I would continue to reassess her respiratory rate, her blood pressure, and her pulse as I waited for the ALS ambulance to arrive.
At this time, the ALS ambulance has arrived.
So I'll give a quick report to the ALS ambulance. So this is my patient. She's a 24-year-old female. Chief complaint was difficulty breathing. She has a past history of asthma. She has an albuterol inhaler for the asthma, or prescription for the asthma. Allergies are penicillin. Last oral intake was breakfast this morning, and she was just sitting on the couch watching TV when this attack happened.
Is there anything else you'd like to do for this patient?
Nope, that is it.
Okay, thank you.